The Astral is a ventilator used here at Bethany Children's Health Center. The Astral's display is a touchscreen. From this screen, you can begin ventilation, put the Astral in standby, view alarms, monitor returned patient settings, and much more. The green power button turns the ventilator on and off. Do not turn off the vent for baths in this way. We will discuss how to put the Astral in standby mode later in this video. This is the power cord. To disconnect the power cord, hold the power cord housing and gently pull the connector from the device. The power cord is equipped with a push-pull locking connector. Do not twist the housing or pull on the cord. To reconnect the power cord, line up the white arrows and insert the connector. If the power cord is disconnected or if the Astral is not plugged in, the internal battery will last approximately 8 hours. The Astral has a micro USB port to allow for wireless monitoring through a modem. Staff with access to this feature can monitor the patient's vent remotely. For patients who have a private room, an alarm cable is needed to notify the nurse's station if the ventilator is alarming. The remote alarm cable attaches from the vent to the wall. To remove the alarm cable from the Astral, hold the plastic housing and pull. Do not pull on the cord. The oxygen inlet has a removable white connector to attach oxygen tubing. The Astral is capable of delivering up to 30 liters of oxygen. The green high-flow tubing is not required to deliver high amounts of oxygen with the Astral. This is the air inlet. Please do not cover or block as it may cause the Astral to overheat. Centered below the display screen is the silence reset button. Pressing the silence reset button will silence the ventilator for 2 minutes. The button will flash indicating the ventilator is silenced and will continue to flash for 2 minutes or until the ventilator is unsilenced. To unsilence the ventilator, press the silence reset button while it is flashing. The Astral is no longer silenced if the silence reset button light is off. If the silence reset button has a steady light, an alarm is actively occurring. Below the silence reset button is the alarm bar. If an alarm is occurring, the alarm bar will light up red or yellow based on the priority of the alarm. A flashing red alarm is the highest priority. Flashing yellow is moderate, and lowest priority is solid yellow. If there is an active alarm, the type of alarm and priority color will flash in the information bar. Once resolved, the alarm type will be shown in the information bar, and the color of priority is displayed as a border around the text. If multiple alarms have occurred, the highest priority alarm will be what is displayed. Always respond to every alarm no matter the priority. Assess your patient first and then troubleshoot the alarm. If you are unable to easily determine the cause of the alarm and your patient has a change in vital signs or status, bag the patient and call a respiratory therapist to come assess the patient and the vent. High priority alarms, such as the circuit disconnect, will audibly alarm as well as flash until resolved. If the Astral is silenced, no audible alarm will be heard. However, the alarm bar will continue to flash until the alarm is resolved. Only RNs, LPNs, respiratory therapists, and providers are allowed to silence the ventilator. Do not leave the patient while the ventilator is silenced. To the right of the silence reset button is the therapy indicator. The therapy indicator will flash a blue light if the Astral is in use. If the light is solid green, it is in standby. At the top right of the display screen is a screen lock button. When the screen is locked, you are unable to access the ventilator interface. To lock the screen, press the icon and it will light up orange. To unlock, touch anywhere on the screen and follow the prompts. The vent should be locked at all times and will automatically lock after 2 minutes of inactivity. To view a patient's return settings, press the monitor button on the right side of the display screen. On the left side of the display screen, select the monitoring button to view the patient's respiratory rate, tidal volumes, FiO2, and much more. To put the ventilator in standby, such as when giving a patient a bath, press and hold the Stop Ventilator button on the bottom of the display screen for 3 seconds and then follow the prompts. You will need to disconnect the oxygen from the back of the ventilator prior to putting it in standby. Standby will be shown in the information bar and the therapy indicator will be solid green. Remember to turn off the heater. To start the ventilator, press the Start Ventilation button at the bottom of the display screen. The Astral will begin ventilating immediately. You can verify ventilation by the therapy indicator flashing blue. It will also no longer show standby in the information bar. Remember to reconnect the oxygen tubing and to turn the heater back on. To transport a patient on the Astral, you must bypass the heater. To do so, turn the heater off and disconnect the yellow and blue wires located at the side of the heater, allowing both wires to hang down. Disconnect the long ventilator tubing located at the heater and quickly attach it to the bacterial filter at the ventilator. The short tubing that was disconnected from the bacterial filter can be connected to the water chamber at the heater, creating a loop. This will keep dust and debris out of the water chamber. Never remove the temperature probes from the circuit, as this will cause a large leak and a high priority alarm. Remember to utilize an HME since the patient is no longer receiving humidification from the heater. Once the heater has been bypassed, you will need to disconnect the power cord, micro USB, and alarm cable, if applicable, from the ventilator. If your patient requires oxygen, disconnect the oxygen tubing from the wall and connect it to a portable oxygen tank at the appropriate liter flow. Turn off the oxygen at the wall. To remove the Astral from its stand, pull the metal pin located on the underside of the Astral and gently slide the Astral back and upward. After the patient returns from transport, reconnect the power cord, micro USB, and alarm cable. Reconnect the oxygen tubing to the flow meter at the wall and adjust to the appropriate liter flow. To reconnect the ventilator circuit to the heater, disconnect the long ventilator tubing from the bacterial filter and quickly connect it to the water chamber at the heater. The short tubing should be connected to the bacterial filter at the ventilator. It does not matter which end of the short tubing you attach to the ventilator. Plug the blue and yellow wires back into the side of the heater and turn the heater on. Remember to remove the HME. It is important to empty any water that accumulates within the ventilator circuit. Do not empty the water back into the heater, as this causes increased bacterial growth in the water chamber. The water will need to be emptied into the basin located at bedside. To do so, disconnect the blue and yellow wires from the side of the heater, allowing them to hang. At the heater, disconnect the long vent tubing that goes to the patient and empty the water into the basin. Be careful to direct water away from the patient and to keep the blue and yellow wires dry. We will be utilizing two different types of circuits with the Astral. The blue circuit is the single limb heated wire circuit with a constant and intentional leak. This intentional leak is caused by an adapter piece called a whisper valve. This leak is how the patient exhales. The whisper valve is located between the ventilator tubing and the patient. It is important to keep the whisper valve exposed and free of bedding, stuffed animals, and other items. The other type of ventilator circuit is clear and has two long pressure lines that attach to the front of the ventilator. If these lines become disconnected, a high priority alarm will activate. This circuit does not have a whisper valve, so you should never feel a leak. With this type of circuit, it is important to keep the tubing upright so no condensation will get into the pressure lines. All ventilators should be plugged into the red outlets. The red outlets are connected to a generator and ensure the ventilators continue to stay on during a power outage. Please remember that only the provider and the respiratory therapist are able to make changes to the patient's settings. If you have any questions, you can contact any respiratory or nursing educator, as well as any charge respiratory therapist or charge nurse.